Lots of women get prescribed vaginal estrogen, but they don't understand its utility, its safety, and its effectiveness. At the end of this video, you will know why urologists prescribe vaginal estrogen, why it's important to many symptoms, especially in the perimenopause and postmenopausal women, and that it's safe and effective. Vaginal estrogen is a topical cream that is a prescription because it has estrogen or a hormone in it. You can either get this, there are some brand names, so you can get a brand name prescription, both bioidentical and not bioidentical, and you can also get it compounded at a compounding pharmacy. So who is given vaginal estrogen? Women who come and see me with recurrent UTIs. One of the number one strong recommendations for the national guidelines in women with recurrent UTIs is vaginal estrogen. What is the role of vaginal estrogen in urinary tract infections? So vaginal estrogen improves the health of the vulva and the vaginal tissue. This tissue and health decreases after menopause when our natural estrogen goes away. So by replacing the vaginal estrogen, the pH changes, so E. coli and pathogenic bugs don't like it as much. So you're improving the bioflora down in the vulva that helps prevent the bad bugs going from the stool up into the urethra. In addition, it improves the tissue strength and it helps the vulva protect the urethra better. A lot of women postmenopausal will have a thinning of their inner labia and an outpouching of the urethra, which exposes the bladder more to bad bugs than if it had normal, healthy estrogen tissue to help protect the urethra. So what's the difference between systemic estrogen and vaginal estrogen? Vaginal estrogen is very low dose. I tell women if they feel systemic symptoms, breast tenderness, headaches, any symptoms from their vaginal estrogen, they're probably using too high of a dose. So vaginal estrogen only should affect the vulva, urethra, and vagina. Very different than systemic estrogen, which is a much higher dose. And ask your regular primary care doctor if systemic estrogen is right for you. That's a different conversation. So vaginal estrogen can come in pills, in creams, in rings. I prefer the cream because I see a lot of people for vulvar pain, recurrent urinary tract infections, or urethral prolapse. And I feel like the cream needs to get on the vulva and the urethra, and putting a tab of estrogen up in the vagina doesn't reach these tissues. So this is my standard spiel for women, is it comes with an applicator, which in a lot of postmenopausal women is very uncomfortable. So I tell them to throw it away. The other reason to do that is it's a much smaller dose if you just put it on your finger, like a sunscreen amount or a toothpaste amount or eye cream amount. And you put it down in the inner vulva and on the urethra. Standard is 2 to 3 times a week, but certainly you could use it more. And I see a lot of women who need to reverse years of vulvar atrophy, so I tell them to use it more liberally. The other thing about vaginal estrogen is people ask, how long do we have to use it for? I tell people you have to use it for the rest of your life. Your estrogen stores go very, very low after menopause, and all these tissues are very hormone sensitive. They need to be replenished and refueled. And I akin this to sunscreen. You don't use sunscreen once and expect it to affect your skin for the rest of your life. You have to keep applying sunscreen in order for it to have its effect. And that's the same as estrogen. Estrogen takes a while to work too, because it's not just a lubricant, it's actually rebuilding the tissue from the inside out. So it will take a while to see the effects. But usually if a woman gets started on vaginal estrogen, within a couple of weeks she's already noticing that her symptoms of vulvar vaginal atrophy are much improved. So takeaways from this video. Number 1, vaginal estrogen is much lower dose than systemic estrogen and is very, very safe in most women, unless you're actively being treated for hormone-positive breast cancer. Even then, to consult your doctors, it might still be allowed because this is much lower dose than systemic. Number 2, you have to use it for the rest of your life. It's like sunscreen. If you don't use it, it doesn't work. And it's there to actually rebuild the tissues from the in to the out, not just acting as a moisturizer or a lubricant. And number 3, it's used for many things in the urinary field. Vulvovaginal atrophy, pain with sex, recurrent UTIs, urethral prolapse, many things are improved by restoring the natural pH and the natural microflora of the vulva. Thanks for listening. I hope this was useful. Any questions, leave them below. And if you think that there's a woman who needs to understand this better, please feel free to share. It's always appreciated. Thank you.